South Sudan is the world's youngest nation. Merely 8 years old, it lacks certain basic necessities. Poor medical services, inadequate water supply, and power cuts are commonplace. In May 2017, Dr. Zhu Xingguo became the head of the 5th Chinese medical team to South Sudan. He was in charge of a 15-member team assigned to work with the South Sudanese medical workers at the Juba Teaching Hospital, the only referral hospital in the entire country. One of their tasks was to help lift the medical standards at the facility. But what Zhu encountered surprised him.
比我想象的还要差，病房里面的环境呢是脏乱差，苍蝇到处乱飞，好多病人的伤口感染了。
The situation was so bad that sometimes doctors would opt not to treat patients for fear of introducing further infections into the hospital. This was the case with a young woman named Asia.
她是面部一个腮腺肿瘤，她在当地看了许多地方啊，都没有人敢接受这种手术。
I come several times, but no doctor can help me.
Zhu decided to operate on Asia as soon as possible. But the local medical condition brought greater uncertainties to the operation, and the surgery itself proved to be far more complex than estimated.
这种手术做完了以后呢，就容易损伤面神经，出现面瘫呐，这种不好的后果啊，所以我压力也非常大。
Dr. Zhu even consulted specialists in China for their advice. Fortunately, the operation was successful, and the patient recovered perfectly afterwards.
我心里感觉到一颗石头就掉下来了，心里也非常开心。
I feel happy,
You're happy.
but I don't know what can I give to doctor.
Asia was lucky. For many of her South Sudanese peers, timely access to medical treatment and recovery remains a faraway dream. Africa is the second largest and second most populated continent on Earth. It had an estimated population of 1.2 billion people in 2016. By the end of the century, it will host 4 billion people, more than 1/3 of the global population. The World Health Organization's WHO Africa Regional Health Report 2014 found that 19 of the 20 countries with the highest maternal mortality ratios worldwide were in Africa. The African region had some of the highest neonatal death rates in the world. It also found that non-communicable diseases, such as hypertension, heart disease, and diabetes were on the rise, and injuries remained among the top causes of death in the region. The report offered ways to address the health challenges over time, given sufficient international support. China is one of the countries that have stepped forward to lend humanitarian support to countries in the African region. Its history of sending medical teams overseas dates back to the early 1960s. China sent its very first medical team to Algeria in April 1963 at the invitation of the Algerian government. According to the National Health Commission, as of July 2018, China has dispatched 26,000 medical staff to 71 countries and helped 280 million patients in Asia, Africa, Latin America, Europe, and Australasia.
对发展中国家的医疗援助是在从原来以这个临床服务为主到现在是以临床服务和这个公共卫生服务以及是提高医疗卫生能力这个都是兼顾的这么一个发展的这种态势。
Besides sending medical teams, China also offers training programs for medical personnel from other developing countries, especially from Africa. For instance, the Chinese government has committed to strengthening health cooperation between China and Africa under the framework of the Forum on China-Africa Cooperation. One example is a cardiovascular program that was jointly launched by China and Ghana in 2014. Under it, 13 Ghanaian medical staff received training in southern China's Guangdong province, enabling Ghana to build its own team of cardiologists upon their return home. Chinese medical staff also conducted 30 cardiovascular surgeries free of charge in Ghana and helped carry out the country's first epidemiological survey on heart health among local non-patients. The United Nations 2030 Agenda for Sustainable Development focuses on ensuring healthy lives and promoting well-being for all, at all ages. Because healthy people are the basis for a country to improve its comprehensive national strengths and sustainable development abilities. More importantly, nothing would stop China's endeavor in lending a helping hand to other developing countries in need, as the country bears one vision in mind: building a community with a shared future for mankind.
我作为一名医务工作者，我的任务主要就是治病救人。我们就是希望有更多人参与到医疗员外之内，然后呢，共同的战胜疾病。